New projections from the state health officials about the spread of coronavirus here in North Carolina.
Their message remains urgent. Social distancing will save lives. Here are the latest numbers. There are 2,870 COVID-19 cases in North Carolina. That's up about 800 cases since Friday. State health officials report a total of 33 deaths. 270 people are in the hospital tonight, and more than 440,000 tests have been completed.
And within the last 15 minutes, CBS 17 has confirmed 59 cases of COVID-19 at the Federal Correction Complex in Butner. That brings the Granville County total to 76. Last week, there was just one case at the federal prison there.
We're getting a closer look today at when experts here in North Carolina believe we'll see a surge in patients in hospitals and if those hospitals have the resources they need.
But what ultimately happens hinges on whether we maintain social distancing past the end of this month. CBS 17's Capitol reporter Michael Hyland is getting answers live just outside of Wake Med. Michael.
Under a couple of scenarios we saw today, the surge at hospitals does not happen until May. But unlike other projections and models we've seen, the data here is specific to North Carolina. Ultimately, the researchers say that what we do over the next several weeks will impact how bad things are at hospitals like Wake Med. I want to show you this graph that they shared with us. The white line that you're seeing here shows if the state maintains social distancing measures past the end of April, then there's a lower likelihood of hospitals running out of beds in mid to late May. But if the state lifts social distancing at the end of this month, that's the red line, which shows a 50-50 chance of hospitals running out of beds soon after in early May. The researchers also say if we maintain some social distancing policies past the end of this month, North Carolina could expect to see about 250,000 people infected by the 1st of June. But if the state lifts those social distancing measures, the number triples to about 750,000. I talked with Dr. Pia McDonald from RTI International, one of the researchers who put together this report.
Social distancing slows this outbreak down, and the more we can slow this outbreak down in our communities, the less chance we will have of overwhelming our healthcare system.
Governor Roy Cooper has put in place a stay-at-home order that lasts until the end of April, and he's also closed schools until mid-May. His office released a statement today highlighting the conclusions of this report, and I followed up to ask if that means he's going to extend the stay-at-home order past the end of this month or keep schools closed any longer, but we did not get a response. Live in Raleigh, Michael Hyland, CBS 17 News.
Michael, thank you.